So much for inviting me. So I would like to talk about the advancing women's health with adaptive management paradigm of holistic and quality healthcare approach. Now, what exactly we mean by the adaptive management and why should we do it? So first of all, to give a pretext, the adaptive management aims to provide a near real-time information about what works, how it works, and what exactly are the challenges, and why so the managers and the other decision makers who are the policy makers as well in the health sector who are dealing directly with women's health care can analyze and draw lessons from this particular information and can rapidly act to make adjustment where needed to improve the overall healthcare programming. Now, there is a point of reflection when we talk about what adaptive management is and how it should be, relating to the healthcare sector, especially when we talk about health. So, a non-adaptive management manager would do the same thing on Wednesday that they did on Monday. So, no matter what happens on Tuesday. So in very short and brief and in a layman language, we can say adaptive management is something where we manage and we understand gaps in a day-to-day policy or interventions which we are doing in the healthcare sector, especially, made for women. And then, accordingly, we adapt and revise the strategies. It also relates to the system thinking, which is ultimately in the healthcare one. So the system thinking and analysis of any country's health economics usually assist in embedding the complex interventions like quality improvement and sustain their achievements. So here it is worthwhile to say that adaptive management have a strong potential to provide better health outcomes. It has better, provision of delivery of health services with lesser gaps and also provide a very stronger healthcare systems applicable to all the geographies. Now, while we're talking about, improvement and analyzing the gap and judging the gap and then, adaptively managing the healthcare system. So it sometimes referred to also as a kind of quality improvement in health sector. But there is a little difference. So what's the difference between quality improvement and adaptive management? So while on the screen, you can see the quality improvement in public health can be defined as a cyclic process of measuring a performance gap, the understanding of the causes of these gaps, then testing and planning of the strategies which we want to play in to improve these gaps and implementing interventions to close the gaps. So studying the effects of the interventions and planning additional corrective actions and responses, we, sometimes in brief talk about and call as quality improvement. And while the quality improvement measures are one of the approaches in the adaptive management to achieve the desired health results. However, in some contexts, these are used as an interchangeable terms. Now, let us see a success story where actually the implementation of adaptive management resulted in the improved maternal and neonatal survival, directly relating to and affecting and improving the women's health. So in the year 2008, the Ghana Health Service introduced a national policy to improve its maternal and neonatal survival rates. Now, how they did was they, adapted the two adaptive management the cycles. That is, one, they increased the skill of the healthcare worker, which are directly involved during labor, during delivery, and immediately providing the postpartum care to the woman. And second, they enhance the surveillance visit of these women within the first week of life post-delivery. So here the frontline health workers, which were directly involved in the care of the woman post-delivery, use the quality improvement to diagnose the process and system failures that can lead to preventable child deaths. And this adaptive driver model, where they are all the healthcare workers are using the quality improvement part to diagnose the process and system failure, was used to help identify determinants of improved child survival and facilitate the local change. Now, if we see the outcome of these two aspects or these two adaptive management theories which was put in place, the health facilities have adopted the new practices, that is triaging system for severely ill women and children. Another thing which was adopted was the more culturally acceptable birthing position. Then they link the new mothers to community health staff, which actually help to improve the neonatal and the postnatal care systems. Now, the links that are made between traditional birth attendants, the community health officers, and community volunteer officers, and the home visits were made. Another outcome of this particular effort was the cultural barriers that were addressed that prevent women from announcing pregnancy and seeking care in first trimester. So these cultural barriers were addressed, where in the prenatal period, the woman was, due to the cultural barrier, they were not coming out in open and announcing their pregnancy so that they could receive the proper care. So that barrier was addressed. And the third thing was at the postnatal care. Now we have seen in the earlier strategy, I'm going back to my earlier slide, so you can make a correlation and linkage what I'm talking about is. The second thing which were adapted was the surveillance visits within the first week of life after giving birth of the child. So here, surveillance visit, if you see the third pointer, so the postnatal coverage increased. So here, in the mean of 15% to 71% visits were increased within the first 48 hours, which actually related and directly impacted, resulted in a good postnatal care to women and the baby. And then the visit of on the day 6 or 7 post-delivery increased from 0% to 53%, actually benefiting again the woman's health and the baby's health. And means killed delivery has increased from 56% to 82%, which actually resulted in a better outcome and a better maternal care and reducing the neonatal mortality. Now here, another aspect, once we talk about after, assessing the systems gaps and adapting the adaptive management strategies to put in place to address the women's health. So engagement of the public health frontline healthcare staff in adaptive management is equally important. So here the frontline health staff have direct contact with clients so that they have a better programming experiences with the changing circumstances. Now, if we see a balancing consideration of the adaptive management, so here we are seeing the three, best things to look at. That is, the frontline healthcare staff has direct contact with the client so that they have best place to see firsthand how well services are meeting the needs of the clients which are coming, especially when they are women in the healthcare system. They have first-hand knowledge of the feasibility and acceptability of the programming strategies. And the frontline healthcare staff can observe and report unanticipated changes. So when we talk about women's health, so here, apart from adapting and doing a quality gap analysis, engagement of the frontline healthcare staff is also a chief primary importance, to improve the women's health in a public health domain. Now, going further, let us look at very brief and adaptive management cycle. So here, we actually adapt and implement and, taking three things into aspect. First, we want to prepare, then we want to monitor adaptively, gathering the real-time information. And at last, we want to pause and reflect what actually went well and what actually went wrong. So here, when we are preparing this, so while we are preparing for any public health policy or implementation plan, here we want to describe goals and assumptions, which directly affect and improve the healthcare aspect and healthcare prospects. So here we can define the theory of change with the learning agenda. When we talk about theory of change, that means here in our preparation, we want to lay down a roadmap which actually define what exact healthcare change we want to see in our journey of this healthcare and implementation of one particular plan. So here we can talk about barriers, here we can talk about strategies, which are really helpful and which we want to implement. And then the learning questions, what actually we want to ask from this particular health data. And then we systematically describe the 3 strategies in this theory of change. The next comes is we monitor. After describing the theory of change as a roadmap, what exactly the change we want to see, we actually monitor the real-time data regarding what are the determinants of health here we want to see, what are the gaps, are the data talking about the real-time situation which we want to assess, are there any gaps, are there any duplications, is the quality measurement okay? For example, we have just seen a very good example of Ghana, the study which was done in 2008, which they were able to improve the maternal health and reduce the neonatal mortality. So here, what exactly they did, they must have collected the data, they must have collected the real-time information, and then, provided then the assessing the gaps and provided a real-time quantitative indicators and assess, adapted accordingly. So while we are monitoring we want to create a dashboard with the real-time quantitative indicators. Now, these indicators not only can be quantitative, but can be qualitative in nature as well. And the second thing is we can have this qualitative information through most significant change and through pulse polls, etc., of the healthcare workers who are directly involved in the care. Then we can have pause and reflect meetings, which is based on the monitoring info, where we can have the data review meetings frequently at local levels of the healthcare providers. Then we can have lesson learned meeting, which are less frequently at the higher levels. And at last, we can have other mechanism of the review, that is after action review and the review of the theory of change, and which exactly completes the adaptive management cycle. So, and that's how, by putting the adaptive management in place, we can improve the overall structure of the public health, and the implementation plan of the healthcare setup, which we want to apply in that particular scenario. So with a very